Hello everyone, I am Rufia Abbas on behalf of Sen Biotechnologists Association. In this lecture, we are going to talk about hepatitis B, transmission of hepatitis B, diagnosis, and we are going to talk about treatment, symptoms, and vaccination of hepatitis B. Hepatitis B. Hepatitis B is sometimes called hepatitis B virus. That is a part of group of hepatitis viruses that attack the liver or damage the liver. It is a member of hepatinovirus. It is enveloped with icosahedral nucleocapsid core containing a particular double-stranded DNA genome. It may be caused by alcohol, drugs, autoimmune diseases, metabolic diseases, and many other viruses. It envelope contains protein called surface antigen. Mode of transmission of hepatitis B. Hepatitis B can be separate and transmitted by several ways, including exposure to infected blood. Sexual transmission includes sex workers and homosexuals are particularly at risk. The second is needle sharing. Some people inject in drugs using contaminated equipments. Parenteral route. It can also be passed from mother to her child, particularly in countries where the infection is very common. Symptoms of hepatitis B. Many people with hepatitis B do not have any symptoms. If we do get symptoms, we may not notice them until 2 to 3 months after infection. Here are few symptoms which occur during hepatitis B. The first one is fever, fatigue, nausea, vomiting, abdominal pain, joint pain, jaundice. Sometimes pale colored stools are passed, dark urine, unexplained weight loss occurs. Risk groups for hepatitis B virus infection. These are the few risk factors of hepatitis B virus infection. The first one is infants born to mother with hepatitis B, people who inject drugs or share needles, syringes, and other types of drug equipment, people who live with someone who has hepatitis B, people on dialysis, sex partners of people with hepatitis B, healthcare and public safety worker exposed to blood on the job. Or hepatitis B can be separate through contact with blood, semen, and other fluids from an infected person. Let's talk about the prevalence of hepatitis B virus. The prevalence of chronic hepatitis B virus infection varies greatly in different parts of the world. The prevalence of chronic hepatitis B virus infection worldwide could be categorized as high, intermediate, and low. More than 2,000 million people alive today have been infected with hepatitis B virus at some times in their lives. Every year there are 4 million acute cases of hepatitis B virus and about 25% of carriers. Million people a year die from chronic active hepatitis. In Pakistan, 7 to 9 million carriers of hepatitis B virus with carriers rate of 3 to 5%. If symptoms occur, they begin an average of 90 days after exposure to hepatitis B virus. Let's talk about diagnosis of hepatitis B virus. Detection of hepatitis B virus infection involves serum, blood test, antibodies. Serum or blood tests they detect viral antigen and antibodies produced by the host. Serology. HBsAg. It indicates infectious person and used to make hepatitis B vaccine. Its presence in blood indicates current hepatitis B infection and it is also called surface antigen of hepatitis B virus. The second one is anti-HBs. Hepatitis B surface antibody indicates recovery and immunity from hepatitis B virus infection. It also develops in a person who have successfully vaccinated against hepatitis B. The third one is HBeAg, hepatitis B antigen. Viral proteins made by the hepatitis B virus and released from infected liver cells into the blood. It indicates replicating virus and the person has a high level of hepatitis B virus. This, this test detects how much virus is in the blood as a result very acute or very active viral replications. Treatment of hepatitis B virus. Treatment for hepatitis B depends on how long we have the virus. Treatment of chronic infection may be necessary to reduce the risk of cirrhosis and liver cancer. Treatment for chronic infection may be include antiviral medications. Several antiviral medications including entecavir, tenofovir, lamivudine, Hepzibah. Vaccination for hepatitis B virus. Hepatitis B vaccine is given to prevent the severe liver diseases that can develop when children or adults are infected with hepatitis B virus. Hepatitis B virus is available for all age groups. The hepatitis B vaccine is recommended for all children younger than 19 years of age who have not been vaccinated, all adults aged 19 through 59 years, and adults aged 60 years or older with risk factors for hepatitis B infection. These are few references from where you can get more information. Thank you so much for your attention.